Kathy Lindell and I presented a session on goals of care across the disease continuum in idiopathic pulmonary fibrosis, and we followed a patient from diagnosis to disease progression and end of life. And the focus there was on the discussion of goals of care and the changing situation that the patient can be in as their disease progresses. We talked about goals of care as not just code status, as some healthcare providers might feel, but also advanced care planning, goals for therapy, family and caregiver goals, symptom management, and how those needs can change, but that it really should be an ongoing discussion that begins at the time of diagnosis and extends all through the course of pulmonary fibrosis. We also talked about symptom management. Patients have lots of symptoms, not just shortness of breath, but also cough, fatigue, deconditioning, and anxiety and depression. We talked about strategies including pulmonary rehabilitation and oxygen support, but also sometimes anxiolytics and antitussives that can help different aspects of the disease burden. We talked about health-related quality of life and how we see that that really declines in the 2 years leading up to the end of life, and that there is a recognition of the patient's reported symptoms and those patient-reported outcomes as being valid tools for prediction. We're understanding that a bit more.
So in our session on goals of care across the disease continuum of idiopathic pulmonary fibrosis, we talked about the importance of talking and attaining patients' goals of care at the time of diagnosis and at different time points throughout the disease course. What we know about idiopathic pulmonary fibrosis is that the disease course is unpredictable and that patients may suffer acute exacerbations and probably truly never regain what they had prior to that. So it's very important from when the patient is first diagnosed with IPF and throughout the disease course to address goals of care with the patient and their loved ones and make sure that they are aware of the serious nature of the disease. Our goal in caring for these patients is to help them achieve their best quality of life. So we want to make sure that they're prepared for the disease course as it progresses.